Good afternoon and welcome to the Alamo Breast Cancer Advocate Chat. My name is Mary Jimenez and I'm the director for the Alamo Advocate Program. And I'm also the chair for the UT Mays Community Outreach and Engagement Advisory Board and the co-founder of iConsult Group, where I'm currently consulting for 2 startup companies in early detection. Joining me here today is Dr. Surapaneni. She's a medical oncologist that is practicing at the START Center for Cancer Care. She is board certified in internal medicine, hematology, and oncology. She completed her fellowship, medical oncology fellowship at the University of Texas Health Science Center in 2020. Prior to this, she completed her residency in internal medicine at Texas Tech University Health Science Center, Permian Basin in 2017. She received her medical diploma from NRI Medical College in India in 2009. During her residency, she was an active participant in both translational and clinical research. Dr. Surapaneni strongly believes in providing high-quality, evidence-based care and compassion and empathy while all focusing on the patient as a whole. She treats patients in breast cancer and those who are at high risk. Please join me in welcoming Dr. Surapaneni. She will be discussing breast cancer care beyond treatment. Dr. Surapaneni?
Thank you, Mary, for the kind and nice introduction, and pleasure to be part of this session today. Thanks for having me here. Today, I'm going to focus and draw everyone's attention in educating people about how important lifestyle changes are in preventing breast cancer, and also in patients with history of breast cancer, how impactful are these in decreasing a breast cancer recurrence.
There's been over 2 decades of data supporting lifestyle changes. At this year's San Antonio Breast Cancer Symposium, there will be a session on open bar, all you can eat, the impact of lifestyle breast cancer on risk and reoccurrence. Can you please share with our audience today some of the clinical trials that have evolved around healthy lifestyles?
Definitely. The impact of exercise is very huge on breast cancer, which is the topic of discussion that is always missed in terms of prevention and also something in terms of talking to breast cancer patients during their treatments and during their survivorship follow-ups. Our initial data has shown that exercising at least 3 to 5 hours per week, which is equal to 150 minutes per week, has shown to decrease breast cancer incidence or prevent a breast cancer happening down by 20 to 30%. This is a huge, remarkable percentage benefit, and this benefit is applied to women of all age groups, both for premenopausal and postmenopausal patients, which is highly important that you don't have to wait to reach a certain age to be able to get on a strong exercise program, and age shouldn't be a barrier to this. And not only women with high BMI would benefit from regular, consistent exercise program, but also the benefit is more impactful even in women with a normal BMI as well. And I have a slide that is going to give a clear chronological depiction of studies, including meta-analysis, which is a pool of large group of positive data-driven trials that have shown a meaningful and statistical significant benefit with regular and consistent exercise program in breast cancer patients while on survivorship, having to show a significant reduction in breast cancer reoccurrence, with the benefit extending even up to close to 40% approximately. This is not what many people in the community are aware of, which means it's not only the treatments, other lifestyle changes could add more benefits to the treatments. It's like you're helping the pills work better, or you're helping your cancer treatments work better. And that has been the standard recommendation from current NCCN guidelines as well, which is what we follow for our breast cancer patients and also for all other cancer guidelines.
Wonderful, Dr. Surapaneni. Thank you for giving us an overview on this data. Can you discuss the importance of support systems for patients and family.
Yes. So any new cancer diagnosis just brings in a lot of anxiety, uncertainty, fear for patient and both for the family members and also couples. Any emotional support is very important to the patients, not only for family members, but also from their close friends around them, also from their workplace as well, also from the team taking care of them. It's highly important to also interact with patients who are undergoing breast cancer treatments through support groups, and also to interact with survivors, and also interaction of families along with patients in these support system groups reduces anxiety, isolation stress, and also helps patients to cope with their treatments much better and with a better mental support and mental health. Getting counseling by being involved in support groups will not only help patients, but also help families navigate their fears, any practical needs that they have to deal with on a day-to-day basis, and also any relationship changes or stresses that they would ideally have to deal with going through cancer treatments. And it's also very important not only for patients and families. One unmet need is also how to offer a good support system for children. Women, breast cancer patients, this is always a constant worry, as they're constantly worried about kids. How can I support my child? How is my life going to be? What kind of setbacks is my child going to go through while I go through these cancer treatments? Am I ever going to be at my normal, where I can dedicate my life at my full extent to my child? It's always a constant worry and a barrier to the patient. And children, they have their own wonders and worries as well. They worry about, what is cancer? What is this going to do to my mom? What is chemotherapy? Will my mom lose my head? That's what my friend or somebody else told me. Will my mom be able to get back to normal? Will she still be there for me? Am I going to lose her? Or who is going to take care of my mom and me if I am sick? That's a constant worry for a single parent mom, who is going to be there. I am too small to take care of her. Or who is going to come and help with my school activities? Who is going to celebrate birthdays with me? Who's going to tuck me in my bed once I come back from school? Who is going to cook or prep my favorite meals? These are the constant wonders for children, which are not quite addressed in a right way. And a lot of people don't seek attention when it comes to child support. And a lot of the medical oncologists talk about support system for patients, but not always to the children. And children worry about losing a parent, as I mentioned. They worry about family and financial stresses because of the financial burden that mom has to go through as part of the cancer treatment. They worry about isolation. They usually kind of keep them isolated with all the stresses, not being able to get back to their normal pace with their peers. And also the disruption of their daily routine when it comes to less child-parent time, missing some school activities and events, always worried about mom's appearance when mom tries to be there. These are the constant worries as well. So support groups for children, the main focus is to empower parents with tools and strategies to help children be supported, and also to facilitate coping, not only for the parent, but for the child too. So support groups that are available for children, they usually allow an open and appropriate communication. And these sessions are unmasked, which means the support groups, they try to be honest. They try to reassure the child to reduce fear and anxiety that they would go through. They make the child understand that it's okay to normalize and express their feelings. It's okay to feel sad. It's okay to be upset sometimes. They also encourage family and child to keep daily simple, normal, having a consistent, simple play at bedtime. These small things just gives a lot of security to the child that they are not being isolated or separated. which is still the best support that the family or the parent can offer. And also there are support groups or peer programs that are available for children if they are interested to participate. These are also beneficial to child to make them realize and understand that they're not alone in this process and journey. And San Antonio has a strong support group for children, which is called Wonders and Worries. It's very nice to know that we have such a strong support system for children, and it's a non-profitable organization. And it's always important, and I educate my patients who comes for other opinions from outside of San Antonio, always reach out to the local provider to see if they have organizations like Wonders and Worries. And if so, always request for a referral, always seek out for help and attention to your child. And this is also one of the main driving force for a non-profitable heavy organization called Thrival Foundation that is established in 2007 in San Antonio, and Dr. Amy Lang, a breast medical oncologist, being the main founder for the Thrival Foundation. Thrival not only offers support groups or support systems to patients, but also tries to do for families as well. Thrival offers 1:1 counseling for the patient and also has couple counseling sessions. Patients get to meet other women with breast cancer, share their journey, share what they are going through, what they have done to overcome the stress that came with the breast cancer diagnosis. Thrival also does offer good financial support, paying certain bills for patients, and also transportation assistance, including payments for transportation that they have to make to get to the cancer treatments. An excellent funding to many of the research programs or research opportunities that we have available in the community. I always tell my patients, and I highly educate them to be part of the Thrival, as it seems like a hidden secret for our patients here in San Antonio. And apart from the support groups and counseling sessions and extra financial support, Thrival is also actively involved in focusing on lifestyle modifications for patients in decreasing their cancer recurrence. And this is not something that's just for breast cancer. This applies for any cancer patient and also for families as well, where they can focus on what needs to be done in terms of preventing a cancer. And when I say lifestyle modifications, this particularly focuses on exercise, nutrition, and also more artful learning through a program called Diva and Dude.
Wonderful, Dr. Surapaneni. Can you share a little bit more about Diva and Dude program, which is part of the Thrive Well organization? And I know that these are programs that certainly have benefited these cancer patients during their cancer journey.
Definitely. So Diva and Dude, the abbreviated form is deriving inspiration and vitality through participation through certain activities. This was started as breast cancer wellness program in 2007, as I said, by Dr. Amy Lang, as there has been more emerging data showing survival advantage by utilizing lifestyle changes for women with breast cancer who follows a good exercise lifestyle schedule and a healthy diet. As this data began to evolve over years and years, not only for breast cancer, but for other cancer types as well, this program now also is welcoming not only women, but also men with any type of cancer. And not only we focus and talk about survival improvement with lifestyle changes, but in general, the overall quality of life. Patients try to overcome fatigue that comes with cancer treatments. Their energy is much better. The tolerance to treatments is much better. And most importantly, mental health also improves significantly with all these lifestyle changing modalities that Diva and Dude offers as part of Thrival. And normally on a day-to-day basis, it's very difficult for cancer patients to adapt to any change easily just because of the magnitude of symptoms they go through while they are on cancer treatments. And not only because of symptoms, but also because of the cost barriers as well. But Diva and Jude is a free program that is available for patient. And the Diva program also provides a place of sisterhood. We have many patients that came to us telling us back that I miss having a sister, but I met many sisters, during this process of having to shape myself for a better future. And support for women that Diva and Jude program offers is absolutely free, and they just have to go online to be able to register themselves, to be able to participate and get the best out of this. And this program is usually funded by large donors with large and both small corporate sponsorships as well.
Wonderful. I think healthy lifestyles really touches on not only diet and exercise, but the other psychosocial aspects and family unity of what you can do and support your children. So thank you for sharing a lot of this information today. It's been very beneficial, I think, for our audience.
I'm sorry. And I also want to talk more about when we talk about exercise, is regular walking important? Or when we talk about nutrition, what really goes into nutrition? So Diva and Jude focus on exercise programs. Studies have shown that aerobic exercises have shown to decrease breast cancer reoccurrence when compared to strength training. And the combination has shown to be more impactful in decreasing breast cancer, even when compared to just aerobic training. So Diva and Jude focus on strength training, aerobic exercises, yoga sessions to have a good mental health. And these have also shown to decrease inflammation, boost up your immune system, Tai Chi exercises as well. And when it comes to nutrition classes, normally I try to also encourage patients and I emphasize them to follow a plant-rich diet to try to include fruits and vegetables, at least 2 to 3 servings per day. Try to include more nuts and whole grains like whole wheat, brown rice, oats, quinoa, and because these all have benefits in terms of being rich in fiber. They have a lot of antioxidants that can help reduce any cancer risk and maintain a healthy weight. Diet only is more beneficial when it's always combined with exercise. Exercise stands top, and no other supplement is really equal to exercise and diet when it comes down to cancer reoccurrence, especially breast cancer reoccurrence. And also try to limit any unprocessed foods and try to include more saturated fats and healthy fats like avocados, olive oil, just try to consume more fish like salmon. So, Diva and Jude offers good nutrition classes and more demonstration of live cooking classes as well, like how to prep a healthy meal on a day-to-day basis. And this shouldn't be an extra burden. With all the ingredients that you have at home, how to prep a good meal for yourself so that this is not an extra burden to the patient. And also artful healing programs are very important. And this is what women mostly miss during their journey of cancer treatments because they were trying to just focus on family, focus on themselves, and other financial stresses or barriers that they go through. Artful healing programs involves more creative activities that also try to improve mental health for patients. And this could be in the form of a storytelling if they're interested. This could be a poetry that they used to enjoy before they started the journey of cancer, or painting. And many other creative, artful activities are available for patients that they can truly enjoy and make them feel like they can still enjoy and try to be at their normal self as how they were before the cancer diagnosis. And again, this not only applies to patients who have an active breast cancer, and this is for survivors as well.
Agreed. Can you speak a little bit around obesity and breast cancer? Is there a molecular link? And in particularly, can you speak about GLP-1 inhibitors and how safe are they?
Sure.
They seem to be a lot on the forefront right now for other disease states, and love to get your perspective in the space of cancer.
Sure. And again, obesity and breast cancer are interlinked. And I'm not saying this is the only risk factor for breast cancer. There are many risk factors for breast cancer that includes non-modifiable risk factors, which means just being a female. The longer the estrogen is there in our body, that increases breast cancer risk. And I'm not saying that's the only type of breast cancer that can happen in women. About 60% of breast cancers are primarily hormone driven or estrogen driven. Why is this? Because women, we start to make estrogen or hormone starting at our age of a menstrual period until we reach menopause. There is at least good 35 to 40 years of estrogen production that we need on a day-to-day basis, to have a healthy life. And this is one of the reasons why breast cancer risk is at least 2 to 2.5 times higher when compared to all other non-breast cancers, where the risk is usually less than or equal to 5%. Again, most of the reproductive factors or genetic factors are non-modifiable risk factors. So let's focus primarily on modifiable risk factors like cutting down on smoking and limiting alcoholic drinks, how much someone can consume. Is there a limit to it? That's also very important. And current guidelines say that avoiding heavy alcohol use or limiting regular alcoholic beverages to less than or equal to 2 to 3 per week have also shown to decrease breast cancer incidence and also reoccurrence. Similarly, obesity and breast cancer, as I mentioned, they both are heavily interlinked, and BMI or body mass index and weight being a strong modifiable risk factor. Being said that, high BMI increases breast cancer risk because our fat tissue makes estrogen. And as mentioned, majority of the breast cancers are hormone or estrogen driven. Obesity creates inflammation, and inflammation creates alterations in proteins and pathways that are involved in tumor formation, tumor growth, and a cancer to happen. This is one of the reasons why we are also focusing, or there is more need for focus on GLP-1 agonist. And what are these medications? How does this impact someone's breast cancer? Or can this prevent a breast cancer from happening? GLP-1 is primarily a natural hormone in our body that regulates our blood sugar, that regulates our appetite. So the GLP-1 agonists are primarily a medication that acts primarily like a hormone that our body is not having. And these are like helpers that whenever our body is full, when we have a heavy meal or somebody couldn't control their cravings for food, it lowers the sugar, it lowers the appetite, and it can support and aid in weight loss, thereby decreasing the BMI, decreasing the fat tissue, decreasing estrogen, and it also provides good promotive effects in maintaining cardiology and respiratory health. It's very important. And the most common question that I've been hearing in the last 2 years from my patients is, especially in patients who are going through breast cancer treatments or who are survivors, is how safe are these medications when I am on anti-estrogen pills? Is this going to impact the treatments that I am on? Which is highly important because we always worry about safety when we talk about any new drugs that are in the market. And these have been a game changer agents for many patients. And the early data, both the preclinical, which is, the animal studies, and also the clinical data that we have pertinent to the GLP agonist, they have shown that these medications do not make somebody be at increased risk for breast cancer. So the safety is there, at least we know. But again, the benefit of these in terms of patients who are on active treatments for breast cancer is yet to be known, and we need long-term data as well. But again, on a case-to-case basis, Having to lose weight also increases tolerance to some of the breast cancer treatments, like when somebody is on anti-estrogen therapies. Some of these medications indirectly also promote weight gain. The question is, by gain, yes, we are trying to benefit patients by giving the anti-estrogen pills so that the cancer reoccurrence is less, but indirectly we are also creating more weight gain, that is creating more estrogen in the body. So on a case-to-case basis, I'm also having discussions. Yes, there is safety data that there is no increased breast cancer risk or reoccurrence. And, this is the best that we can have. And I usually send patients back to their primary care or endocrinologist to have additional discussion. And there was also some data that was presented at ASCO 2025, which is the American Society of Clinical Oncology, looking at these GLP-1 agonist medications and how did it impact any cancer to happen. And they looked at 14 cancer risk, and that included breast cancer as well. And these medications have decreased the risk of someone developing an obesity or high BMI related cancer down by 7%, and also decrease in mortality or chances of death happening, not only from cancer, but also from other obesity-related chronic illnesses like diabetes-related kidney failure, diabetes-related heart conditions, diabetes-related respiratory conditions or lung conditions like sleep apnea that could indirectly affect the heart. And the risk was also down by 8%, which means these are promising drugs, but there is more to be known. As I said, the question is, can we time these with cancer treatments when somebody is on chemo? Because weight is also a barrier for some women to get to breast reconstruction if the plan was to get them to mastectomy. So this is all yet to be known. And some of the patients who are survivors, who are on the medications, we need long-term data on these patients as well.
Thank you, Dr. Surapaneni. Before we close out the session today, is there any additional information that you'd like to share with our audience?
Yes. And, being said that, as I reviewed before, I'm just going to kind of quickly summarize the highlights of this, lifestyle changes session. Breast cancer risk is 2 to 2.5 times higher when compared to all other non-breast cancer risk in females. And again, as I reasoned, just being a female itself has a higher risk. And always reach out to your physician and make them understand or express your concerns that you have a family member with breast cancer. Your genetic testing was negative, but are you still at elevated risk? Just having a negative genetic testing doesn't mean that your risk is not high. You need to see a provider who can give you a risk assessment despite having a negative genetic testing, and make sure you have a better understanding on what your breast cancer risk is. And if so, are there any lifestyle changes like exercise, nutrition, routine, social habits, anything that you need to change to prevent a breast cancer from happening? Always aim at prevention. Prevention is better than cure. Be up to date on regular routine annual mammograms. This is highly important. And follow healthy lifestyle changes, which are highly important for prevention of cancer, primarily for breast cancer and for patients on active breast cancer treatments and during their survivorship plan also. You're not alone. When in stress during treatments, please reach out to people around you, reach out to services that are available for our cancer patients, reach out for more support in terms of being enrolled in support groups, reach out to seek if your children need help. These are the important things and challenges that breast cancer women go through as they go through their cancer journey. So, which is highly, highly important, as this improves the stress and decreases the anxiety through their journey, while patients can just primarily focus on making them get better.
Wonderful. Thank you so much, Dr. Surapaneni, for taking the time with us today. And a special thank you to our breast cancer patients and survivors who continue to participate in clinical trials to help advance breast cancer treatment. Thank you.
Thank you for having me today.